Okay, so today I'm interviewing Jessica Nicole, nurse practitioner, about cannabis use in healthcare. So, Jessica, tell me a little bit about yourself and your work experience.
Sure. So I'm a nurse practitioner. I work in an outpatient family medicine clinic. I see mostly adolescents and adults, and I spent 20 years as a registered nurse. I worked in home care, hospice, acute care setting, and before that I was a CNA for 5 years. So I've been in the healthcare setting for close to 30 years now.
Okay, that's a lot of experience. How often do you encounter patients who use marijuana either recreationally or medically?
I would say I have noticed that the frequency has increased quite a bit since it became legal in California. I think that prior to legalizing marijuana in California, there were more people with medical marijuana cards using it. But now there's a lot of people just reporting that they're using it recreationally, or they may be using it for something like anxiety.
Okay, so what is your opinion on marijuana being used as a treatment for mental health conditions such as anxiety, PTSD, or depression?
I think for some patients it can work really well. I actually had a patient one time that she'd had suicide attempts and she'd been hospitalized in a psych hospital. She ended up being put on a lot of different heavy antipsychotic medications and anti-anxiety medications that were causing side effects like weight gain and sedation. She had young kids and she needed to be able to function and drive safely and things like that. So she actually discovered that if she used marijuana, it would produce a calming effect and regulate her anxiety, but without the sedation, and she could still safely do the things that she needed to do. So for that patient, she was able to get off a lot of her medications and just kind of rely on short-term use of marijuana when she felt she needed it, and that seemed to really work for her.
Okay. So, based on your clinical experience, do you think cannabis is more helpful or harmful for patients with mental illness, and why?
Well, I think I have a mixed opinion because I do see that it can be very helpful for some people, especially if it's being used rather than heavy medications like benzodiazepines that can have a really high potential for abuse and can be overly sedating. And they can lead to pretty serious addictions for some people. However, I do think that some people may use cannabis as a, let's say, replacement for coping mechanisms. So I think that would be the downfall, where they may just rely on having something to help them ease their anxiety versus actually investing in some therapy and learning some coping skills.
Mm-hmm. Okay. Have you worked with patients who self medicate with marijuana for mental health symptoms?
Yes, definitely. And I think that is a much bigger and upcoming thing with adolescents and those in their early 20s. I hear a lot of people in that age group talking about vaping and use of cannabis, and it is related to anxiety and depression a lot of the time that they're reporting that they use it for those reasons.
Okay. So, do you ever recommend or discourage marijuana use for specific mental health conditions?
For mental health conditions, I think that my comfort level would be more to recommend conventional treatments like antidepressants, anti-anxiety medications, and things like that. Just because I don't have really the training per se on marijuana to recommend that as a medication. But if a patient comes to me and they tell me I was able to get off all these medications and now I'm using marijuana just, sporadically or intermittently, and their symptoms are controlled and they're functioning, that's a win. I'm totally fine with that. But I don't think I would be the primary one to recommend, why don't you try this? I think that has to be more of the patient's decision.
Mm-hmm. Okay. From a medical standpoint, what concerns do you have about cannabis use in adolescents or young adults considering brain development? I know you mentioned you've seen more adolescents.
Yeah, well, that's a lot of the research that's being done currently is more on marijuana use and developing brain. And it does show that there's some potential for irreversible structural changes to the brain. And the effects are worse when it's started early. So if you have a very young teen starting marijuana and then they can develop you can actually develop a substance use disorder to cannabis that will meet like the DSM-5 criteria for substance abuse. You can develop physical withdrawals, and there's effects on memory. There can be effects on problem solving, memories, learning, all the things that, you know, adolescents and young individuals in their young 20s should be doing. It's taking a negative effect on all of those things, which is what the research shows. So I think at that point in your life too, that's when you really should be hopefully developing positive coping skills. And if it's going to take away from developing a support system and developing healthy coping mechanisms, that's a massive drawback in terms of mental health.
Mm-hmm. So in your practice, do you differentiate between medical marijuana use and recreational use when assessing patient health? And how do you get the distinction between the two types of like marijuana use?
I'm not sure exactly what the distinction would be for purely mental health. The patients that I've interacted with who have used cannabis, one, for example, was paraplegic, and it helped him with pain, with muscle spasms, and with some of his other problems that he had related to his paralysis. So again, that was one where the cannabis was replacing several other medications. So I think for him, it made a lot of sense to use it. But I had another patient one time that used marijuana for back pain. And so I think those are more the criteria for using it for medical purposes. But I'm not sure about the criteria for considering it mental health purposes.
Mm-hmm. So do you believe cannabis should be more regulated, less regulated, or remain the same in the family practice setting?
I think what it really comes down to is we need more research. So I think it's very important, especially now that cannabis is very widely used and very easy to obtain. Like I said, I have seen like a real uptick in cannabis use among especially like early 20s and late teens. And people maybe don't understand the dangers of it or the potential dangers. So I think it's wise to continue to do more research before we really weigh in too heavily on the opinion.
Okay, speaking of research, where do you think the future of cannabis research and mental health treatment is headed?
Well, I think there's a lot of interesting research in terms of like psychedelic use, things like ketamine, things that were not previously thought to have any use therapeutically, that possibly do have use therapeutically. So I think as we're investigating those types of medications more for a therapeutic use, I think marijuana can join those medications too, as not just purely a recreational drug that we shouldn't use. It may have some, and I think it does have some benefits.
Mm-hmm. Okay. If research continues to advance, what mental health conditions do you think cannabis has the most potential to treat? Like PTSD, anxiety, insomnia? Mm-hmm. What have you seen?
I think it seems to, well, I mean, not that this is mental health, but it is very heavily influencing people's mental health is chronic pain. Mm-hmm. People with chronic pain are much more likely to be depressed than mm-hmm. those without chronic pain. So I think there's a lot of promise in terms of treating chronic pain with marijuana. Things like nausea, again, it's not a mental health problem, but it influences people's mental health. If they're mm-hmm. just nauseated all the time, they're not going to, have a good mental health. But I think that the one that I see people using it for the most is anxiety. I think that produces a better effect than like for depression, you're already kind of not very motivated, and then the marijuana kind of takes away even more motivation. So I think it's more appropriate for anxiety.
Okay. From your perspective, what does the healthcare system need to do to better support patients who are using or who are considering cannabis?
I think it's all about education. I think at the end of the day, when you've been in healthcare as long as I have, you realize that people are going to do what they're going to do. So you just have to educate them about potential risks and, benefits of the treatment. In some cases, like I said, I do think there is a real benefit to the patients. And I wouldn't really particularly tell a patient, do not do this. I think as long as you give them the education, they need to make that decision for themselves, but the education is the main thing.
Mm-hmm. Okay. Overall, what do you think is the biggest misconception about marijuana and the brain?
I think especially since marijuana became legal in California, I think that there's a lot more casual usage where people may not understand that, like, there is research stating that it can change your brain structure. There is research stating that it can literally lower your IQ. So I think individuals who are under the age of 25 in particular need to understand that this is not a completely benign substance. It's a plant, yes, but depending on the delivery mode as well, you can increase your risk of lung cancer. And then some people are vaping it, which has its own kind of pulmonary complications. So I think the myth may be just kind of that it's harmless and it's just a great way to relax and you can just, use it and there's no effects, there's no harmful effects, you won't get addicted. But really, that's not true.
Mm-hmm. Okay, if you had to summarize your view, is cannabis more beneficial, more harmful, or do you think it's situational depending on the patient and like the individual?
I think it's definitely depending on the patient. I think in medicine we have what we call a risks versus benefits assessment. So anytime you prescribe a medication, anytime you perform a surgery, give a blood transfusion, any of that, there's risks associated with it. So if you have a patient who's extremely depressed or anxious to the point where they're suicidal, the benefit may outweigh the risk. But if you have a patient that's just kind of having some trouble coping with normal life stressors and could maybe benefit from some psychotherapy or cognitive behavioral therapy, and then they start smoking a bunch of weed, that's not really the risk doesn't outweigh the benefit. So it really depends on the patient. It depends on how they respond to the treatment. And if there are other alternative treatments we could use that may not carry the same risk, then you would have to have that discussion with the patient. But overall, there is absolutely a medical use for cannabis, in my opinion.
Mm-hmm. Okay, well, that's all the questions I have for you. Thank you so much for your time. Do you have any final words?
No.
Okay, thank you so much for your time, Jessica.
You're welcome.
It was so lovely working with you today, and I hope that everyone watching this learns a lot from the interview, and I know I learned a lot as well. Thank you.